Day 29 of Learning Exercise Therapy. A patient begins to demonstrate signs and symptoms of a seizure, including uncontrollable muscular movements, convulsions, and confused behavior. Appropriate intervention will include: answer, protect the victim from injury but do not restrain. A physical therapist examines a 6-month-old infant with spina bifida. The infant suddenly begins to act strangely at the conclusion of treatment. A primary survey reveals the infant is not breathing but does have a pulse. The most immediate response would be to: answer, begin mouth to mouth and nose breathing. A physical therapist conducts an initial examination on a patient diagnosed with Parkinson's disease. Which of the following clinical findings would you expect the therapist to identify? Answer, cogwheel rigidity. Therapists often elevate the foot of a treatment table to maximize the electiveness of specific postural drainage techniques. Standard postural drainage position of the dash will not require elevation of the treatment table. Answer, anterior segments of the upper lobes. A therapist develops a treatment program for a patient diagnosed with cystic fibrosis. Which of the following treatment activities will be the most essential to improve ventilation? Answer, postural drainage. A therapist monitors a patient's blood pressure during exercise. Which of the following responses would be considered normal? Answer, diastolic pressure increases 5 mmHg during exercise. In order to maximize the effectiveness of postural drainage techniques for the right middle lobe, a therapist should elevate the foot of the bed dash inches. Answer, 16. A therapist performs percussion over a selected area on the chest wall of a patient diagnosed with chronic obstructive pulmonary disease. The therapist documents the sound as dull. Which structure will typically yield this type of sound? Answer, lung.